I'm really excited for the second half of the community event because we've got an incredible group of panelists, and frankly, I wish we had more time with them. You know, the pandemic has affected us all, but I think everyone tuned in today would agree that what care organisations and their incredible employees have been through over the last 18 months can only be described as heroic. And on that note, I encourage anyone who hasn't seen Help on Channel 4 to do so over the weekend. And those of you who haven't even heard of what it is, it's a drama following a young care worker during the pandemic and the huge struggles she faced on a daily basis. Now, of course, looking at the past is important, but with the new health and social care levy passed at the beginning of the month by UK government, I hope this roundtable will provide the opportunity to discuss what the future looks like and how organisations can better support their employees through this change. So I'll hand over to Holly to introduce our panellists.
Thanks, Chris, and afternoon, everyone. It is a pleasure to be with you all today. And as Chris mentioned, we are very excited to have what can only be described as 4 absolute A-listers from the social care sector. So first up, we have Kirstie, Group of People Director from Salutem Care and Education. She's been in HR for over 20 years, so is an absolute expert in everything we'll be discussing today, looking at employee retention, engagement, and well-being. Also joining Kirstie from Salutem Care, we have the CEO, John Godden. He founded the business over 4 years ago now and is really focused on creating a strong culture of excellence. And Salutem Care became part of the Blink family just over a year ago now. Next up, we have Phil Nielson. He is Head of Digital Transformation at City and County Healthcare Group. With over 17,000 staff and ever growing, Phil is really focused on introducing and implementing the branch model. Going digital has allowed carers to spend more time focusing on the service users. Now, last but no means least, we have Neil Eastwood. Now, I've yet to actually meet someone within the care sector who hasn't met this man. He is CEO and founder of Care Friends, a thought leader in the industry, and he's even published a book. So Neil, I think this would be a great place for us to start. So having worked within the care sector for many years and working with lots of different organisations, it would be great to get your view on what's really top of mind at the moment for executives and their teams.
Yeah, thanks, Holly, and hi, everyone. Wow, well, what a time to be asked a question like that. And as many of you know, even if you're not involved in the care sector, it's we know the sector was underfunded for many years. And then we had Brexit, then we had COVID, then we've had post-COVID kind of reaction. And I would say executives now, if you're particularly in home care, if you need your staff to be driving around, then there's a fuel crisis. And I did already tick off every bad thing that could happen to the workforce in social care. And I had forgotten that there could be a fuel crisis. So there is that as well, although hopefully that's now slightly easing. And then mandatory vaccinations are probably super top of mind for residential care providers. And I'm sure for those of us in home care, we would be looking at that heading our direction. And the prediction is to potentially by the government, we might lose another 70,000 people because of that alone. So these are really tough kind of short-term things that are happening on top of, what is a really, really difficult time with the combination of recruitment and retention. A lack of recruitment or ability to recruit means more pressure on your workforce, means they're more likely to leave, drags managers into taking on shifts themselves. So it's a concerning time, I think, for the sector and for sector leaders and for all of the managers and the staff themselves. And I think what we need to do as a sector is focus on what is controllable, and that tends to be what we can do ourselves locally. And optimization, digitization, I think one thing, if there are silver linings at all with what we've all been through in the last 18 months, there's a good chance that we've all moved far further forward with our digitization agendas than we ever thought we would. And I think, you have to look at how much technology can support us when we will never have the right numbers of enough staff that we need. We have to optimize, make their lives much more, easy at work, more contact time with the clients, I would say.
Definitely. Wow, that was a great snapshot. Thank you, Neil. And as ever, there's always a lot going on in social care. So that was very eloquently and put and concise. So thank you. And I know you mentioned there, obviously, staff retention is always a big challenge across the sector. And even more now with Brexit and other pressures, there's a big staff shortage of carers in the social sector. But I'm sure most people are aware that this isn't only a problem unique to this sector, and other industries are struggling as well. And we're seeing a few different initiatives kind of come up. So some organisations or industries are financially incentivizing people. So if this is through increasing pay or signing on bonuses. So John, maybe if we pop over to you for this one, in your experience, is this like a feasible option for the care sector?
Well, bonuses themselves, yeah, I mean, we've seen them deployed before, particularly around nurses rather than necessarily care workers. But you know, it's a marketplace issue, isn't it? You know, we haven't got the luxury that, say, a restaurant would have, where if they're understaffed, they can choose to open 4 days a week. We have to be open 24/7. So we have to have that staff complement. So of course, you know, ultimately we need to do everything that we can do. And we can talk about engagement and culture and enabling and supporting people. And those things are all incredibly important and ever more important, particularly given the tough times that everybody's been through, as was pointed out with the eloquently communicated in that drama help a few weeks ago, or 10 days ago. But you can't get away from pay. You know, it is ultimately the lifeblood of the economy. And, you know, we've long, for many years, it's been recognized that social care is struggling to justify the levels of compensation that we offer. And it's got an awful lot better, let's be clear. You know, the bottom of the pay stack has been dragged up an awful lot, but there's a long way to go. And, you know, we're really feeling the vagaries of that right now, as we're in a very competitive environment. So everything's on the table, of course it is. But, you know, we have a difficulty in social care that, you know, we can't sort of have a blindingly good product that takes market share away from everybody else. You know, the looking after somebody is looking after somebody, and there's a fee attached to that, which necessarily creates a limitation. And we do need the government to really grasp that nettle, which they've not quite got right yet. But everything is something that we look at. But we would love to pay people more. I would love to pay people signing on bonuses. But in reality, it's keeping the people we've got, because they've got the experience, the training, but most importantly, they've got the relationship with the people that they're caring for. And that's really precious. So actually, we prefer to spend our resources on keeping the people we've got, rather than necessarily constantly attracting more. But everything is on the table. The culture is incredibly important, and something like Blink is actually central to that. You know, at a time over the last year and a half where communication has been more difficult yet more important, we've really had to bring our A game into play, and Blink has enabled us to do that, and it really has made a meaningful difference to how people feel about their work every day. And that makes a difference between somebody wanting to do it and not. But you can't get away from pay. You know, pay is that is the measure of your worth. Unfortunately, in this society, that's how we have to do it, and people do need to pay their bills. So we do everything we can to push as much as we can into our employees' pockets.
Thanks, John. Really insightful. And I mean, you know, you mentioned there that pay is a difficult thing to focus on. Of course, you do as much as you can do, but you know, being funded by local government makes that a challenge as well. So maybe just focusing on the people side of things. You mentioned culture there. You mentioned making it a nice place, a great place to work. So, you know, maybe taking that one level deeper, Kirstie, obviously as people director, you know, this is all within your remit. So it'd be great to understand, you know, maybe a slightly more granular level, what some of these initiatives are that you're doing to help better support your people and drive that culture.
Absolutely, and John's right, it's a balancing act. It's not just about pay, it's got to be about looking after the people. So we've done a huge amount around wellbeing initiatives, and actually for me, the pandemic was horrendous, but one of the good things, the silver lining, was actually we got to Blink sooner than we may have done before. So it's been a fundamental tool in all of our initiatives. So we've done things like the wage stream app and the single sign-on that you've got with you guys, which means people can actually stream their salaries through the month, but also it's a financial wellbeing tool. It's not just about being able to access your salary, it's about a financial wellbeing tool. So we put that in place really quickly. We've done a fitness initiative. So something really, we partnered with you guys actually, which was fantastic. We had Blink and Salutem pedometers that went out to every individual, and I think they went around the world about 10 times the amount of steps that were done, and the teams, and they won. So it was all channeled through Blink, and the engagement that we got, it was fantastic. So really simple but really effective to look after their well-being. We've actually looked at our suicide awareness training, actually, because there's a lot of people that are, they're on their knees a little bit with what's gone on, and they're exhausted. And we've looked at all our training material around that and revamped that, gone back out there and used Blink as that tool to get that out to everybody. And it's given us that ability to have a conversation with somebody really quickly. They can get to me, they can get to John via Blink, and they do. And it's so important that we have that direct conversation, because that they can talk to us. We're revamping our employee voice. We're just going to rebrand it, and so that people have another channel to come and talk to us about the things on the front line. It's all very well John and I sitting in the centre saying, well, we think this is going to work. Actually, let's engage with the people that are on the front line where it really matters. We've looked at our supervision policy. Let's actually, let's have some honest conversations about how they are feeling and their well-being, and actually build that into the supervision so it's really meaningful. So lots of really practical stuff. We've done a fantastic partnership. You guys have worked with WorkBuzz, so we were working with WorkBuzz unbeknownst to us actually via Perkbox, sitting in the background, and you guys have partnered. So our engagement survey is now going to be a quick Blink survey. And we were in a meeting yesterday with about 17 managers, John and I, and the feedback about Blink and how important it is to people, and their ability to speak to them directly, which we didn't have before. John said something yesterday, it really hit home with me, where we could only talk to a quarter of the workforce before we had Blink, because it was emails, and it was really, this is a proper conversation that we've got going. So all of those practical initiatives are aided and abetted by Blink. But yeah, going back to basics almost. So the step challenge was amazing. So yeah, lots of practical stuff, and Blink is front and centre of all of it.
Thank you, Kirstie. And this is not meant to just be all about Blink. I mean, you guys are doing stuff with, as you said, WageStream, which around financial support. It's about WorkBuzz and surveying. There's loads of different tools and systems that organisations have been looking at. And going back to what Neil said at the top end of the call, which is, across industries, across sectors, but certainly in the care sector, COVID has really forced organisations to streamline and speed up their digital transformation to create new efficiencies. So maybe jumping over to Phil, given your role at City and County, it'd be great to kind of understand how you and your team have been leveraging technology to create a better employee experience and support your staff more.
I think for me, it's the recruitment and the employee engagement is based on pretty much three pillars, really. There's the candidate journey, the employee journey, and both of those join together with the data that sits behind those. So, I mean, since I applied for my first job, I think I walked into a shop and asked them for a job, and that was about it. It didn't make any difference to me. I just needed to know how much I was going to earn, and that was all that mattered. And I think the culture and the requirements of someone looking for a job is not all about money. It will always be the primary focus. We can't get away from that. But actually, there are other things that matter, and we've mentioned a lot of them. Kirstie went through a list of things that they've been doing that are the things that make people stay and draw people to a business outside of the salary, and they're the things that we can impact. So, I mean, from my experience, we see people that are actually looking what the business ethos is and what the business values are and what actually their working environment would be. So whether that's an office-based role and they want to kind of see what the office looks like, and is it a Google with a slide and beanbags? Probably not. But it's actually then through to the other side around where the care workforce are based, what they how they're patched up, and what that branch looks like. Then I guess the support element, in terms of, again, some of the things that Kirstie mentioned, there's lots more focus on mental health and the support side of things, and health schemes that are coming as part of the core offering for a role. That certainly wasn't the case back when I applied for my first job. And then I guess it's how each, and this comes back to some of the points that John made, how each of those employees can engage with the centre and engage with their peers and engage with their management to actually have a stake in the business and make a difference to it and support it and grow it and shape it. And there's lots and lots of tools out there that can do that. Blink obviously being one of those. But for me, whilst it's not all about technology, it's about interacting with those people. Technology helps that happen, particularly in the environment of social care where actually it's a dispersed workforce. You can't walk out of your office door and get everybody into a meeting room and start talking to them. There's thousands of people all over the country. So being able to have them into conversational pools, so whether that's a chat room or whatever it may be, actually engaging them and asking them to be involved is the kinds of things that matter to people when they're looking for another role. And if you can overlay that with things like your business ethos and the business values, then in your candidate journey, you're talking about what the environment looks like and you're including photos of the team that they're going to be working with or whatever it may be, just those little bits that make differences along the way will inspire those people to want to work there. And then again, money won't be secondary, but it becomes slightly less important. And actually, if you've got half a bar salary, they're going to pick that engaged in that engaged environment and that environment that they like to work in. So I think the other side of that then falls onto the data point that I was making around actually, if we tailor our candidate journey and tailor our employee engagement journey, then actually using that data to better engage with our employees. And that might be the simple things like capturing dates of birth. So therefore you send them well wishes on their birthday. Knowing that they've got children, you send them a Mother's Day a message or Father's Day message. It might be that actually you're capturing people's hobbies and then you have a non-work related bubble of people that are actually talking about whatever that hobby is. And you might encourage that conversation to build those teams, and it might be north of the country, south of the country. At that point, it doesn't matter what you're looking for, is engagement and support to build the team and build the support within those teams. So I think for me, it's about using the tools, so using the technology that we've got available, but then actually using the information that draws to think slightly differently about how we can support the care workers and the teams that we've got across the country.
Yeah, definitely. I mean, I know it's a term that's used a lot, which is data is king, but it really does allow organizations, one, to react in the moment and communicate better and support employees more, but certainly, as you gather more and more data, it actually enables, organizations and this technology to actually preempt potentially a care worker that is suffering from burnout due to certain signs and actually allow organizations to take a proactive approach to supporting staff. More than if you're still using really basic technology, you're more reacting. I'm not saying that that's one step in the journey, but data does help organizations and to take that journey to best supporting employees. And
I think that's right. And I mean, the ultimate is actually you start tying together the data that you gather from your candidate journey, your employee engagement, and actually the work that they're doing, and then you start looking at that as a whole piece for each individual. And the ideal is you tie into that and it informs that decision. So actually you can support people proactively rather than having to have a concern to look at the data. The data does that bit for you and it helps you help them a lot sooner than might be certainly be possible without the technology.
Definitely. And I guess talking about data, I mean, Neil, maybe linking employee engagement, retention to what we talked at the beginning of the call, which is around bringing in new talent as well through internal referrals. So, I mean, given your work with our friends and working across the industry, I mean, do you see a correlation between organizations that engage or have higher levels of engagement with their staff and having more success with internal referrals?
Yeah, I do. I mean, I would say that referrals are kind of a bellwether for your company culture and the engagement, because you are unlikely to want your friend to come and work in an environment which you have intention to leave. So it's always a good indicator of, the culture of the company and the employer brand. Having said that, we do speak to care staff and who refer, and their primary aim is to help their friend who they think should be doing this job. So one of our challenges recruiting in the sector is that pretty much everything on a CV is of no help to us at all. Even if you failed at lots of jobs like I did before, there's always a home for someone with the calling for care in the sector. So finding those people is important, and the best workforce to do that, or the best recruiters, are the people that are doing the job. And so bringing those people in through in the local community. And I think, you know, we are facing a recruitment crisis, but, you know, the recruitment is all very, very local. So within about a 6-mile radius, most of the staff would come from a care setting. So, you know, they were almost within touching distance. So we've got care staff who are trying to help their friends who they're handpicking. They know they shouldn't be working in Tesco or as a petrol delivery driver. No, they should leave those guys alone. And then I'm bringing them into the organisation, and they want to help their clients. So their clients and their residents are probably the glue that keeps the whole of social care on the road, I think, you know, given the pay constraints and so on. And so we know that goodwill that we've traded on for a long, long time in social care is that they want the best for their residents and their clients. So that's the second thing. And then they want to help the organisation out, and they understand that you know, the pressures, and they are very happy to be recruiters. And I think also there's a money element. Of course, they want to, it's nice to get the employee referral bonus, but we do know if you increase the bonus, you know, hugely, but you still make them wait 6 months before they get that bonus, then not much happens. So it's not really about the money. It's about immediacy. It's about instant gratification. It's about you know, putting in the effort and hearing and getting a reward for it. And I guess this, when you look at, you know, the reasons why referrals would be higher in one organisation than another, then you are looking at the communication channels. We know that referral schemes are often forgotten. They're very hard for people to know that they even exist. The company mission needs to be clear. You know, people need to feel part of this. And as Phil said, you know, with a dispersed workforce, that can be a real headache. We know that a lot of people leave, and the worst staff turnover period is the first 90 days of employment in social care. It's, you know, can be, remembering my times in home care, being a director of 10,000 staff, we lost 97% of them a year, which was horrific. But if you look at it, it was hundreds of percent in the first 90 days, and actually not too bad after that. So it's about people feeling lonely, isolated, unsupported. So it's so important, the communication, two-way communication, to give people access to training, to their supervisor, creating peer networks so people can ask questions of each other. And we know that peer networking, peer mentoring is one of the core things you can do as people join. So it's those kinds of things, I think, you know, that support both referrals but also enrich the company culture. And it can never be, we'll never compete on the money ever. We'll never do that, because Amazon will just pay an extra £1,000 welcome bonus to join them, you know. But all care staff need to be paid more money, but we do need to think of other ways. They've come into this for a calling, I think, rather than choosing what's paying the highest hourly rate.
I think just to add to that, Neil, I think one of the things that's important for me, whereas from a recruitment perspective, is I don't recruit care workers, but I recruit people into the central teams and the support teams. And even them having that ethos and having the empathy to understand how they, as individuals that might be 4, 5, 6 degrees removed from the actual care delivery, that matters, and that matters to the people that they're working with and they're communicating to. And if they haven't got that, then actually they're probably not the right person, even though they're not the front line. It really matters, and it makes a difference internally. And I think that's another thing that can't be underestimated, is the support that surrounded it, having the right level of support and the right people in those positions.
That's very true, Phil. And it's actually been exposed through COVID that the relationship between frontline care workers and the middle, back office or head office staff clearly was dislocated during that period, and it created problems because people didn't have that understanding of what the other one required, was going through, etc. And it is very much a two-way street. The person in the finance team really needs to understand what they're doing and the importance of it to the people on the front line. And the people on the front line want to know that the people in finance have sympathy towards what they're doing. So we actually encourage people to go out into services quite a lot. We've actually been doing it today despite slight lack of fuel to get around. So we've taken some of our support staff out into services to meet with managers and others. And it is part of the culture. It's part of the feel of family and all of those things that really genuinely make a difference to people. And I think sometimes people forget that. The other thing we do is make sure we treat people equally. And actually vaccine policy was a case in point. And, you know, it has been a very difficult topic. And we've treated people in head office the same as we treated frontline workers for equality. We're all in it together. And ultimately, somebody like me, I need to go and spend time with people in the office, but I also need to go into services. So you've got the safety matter. But people really appreciate the fact that it's not one rule for somebody and one rule for somebody else. And that feeling of fairness, equality really does echo around a business that is so reliant upon people.
It also brings us back to technology. Actually, just thinking about your recruitment, something Neil said earlier about it being local. I can talk to people directly about what works in their local area and how that refer a friend and those schemes can work and what things we should be using. And I couldn't do that without technology. I'd be relying on a layer of management rather than actually talking to the people that are on the ground that are going to refer their friends. So that technology piece is vital. It's been vital with the vaccine policy to actually talk directly. John and I have had direct conversations with people about the vaccine policy that we wouldn't have had before had we not had technology to enable us to talk to them directly. So that technology piece is vital in all of this because we are a dispersed workforce and we've not been able to get out to speak to them as much as we have been in the past.
Actually, the best bit is you get somebody, a care worker. These are the most important people. Actually, you get them. They'll post something. They'll react to maybe a post that one of us has put up, and they'll put a query up or a statement up, and man, are they surprised when I reply, or Kirstie replies, or something. But they love it. They absolutely love because. What are we, 3,000 people, and there is one chief executive and 3,000 of them, and I'm no better than them. I've just got the silly title, but they love the fact that they get the attention, the real attention of these other people, and that's what technology enables. Before we had Blink, we were very, very restricted in how we could do that, and indeed. Me being able to engage with it was just too much work. I mean, it was just too hard for me to do that. So enabling us to be able to communicate that in that way is so important.
Definitely. Lots of great conversation here. And I think just got one arm at a time. And we've discussed a load of great challenges, but I think the one thing which is really clear is how it all links back to employee engagement and employee experience. And I think, you want to get increased referrals internally, as that's the best source of recruitment, and this will help you to close the carer gap, and then help you to retain more of your staff, which obviously takes pressure off recruitment and ultimately helps everyone to provide better care. I'm conscious that we're almost out of time, but before I hand back over to Sean to wrap up the event, I just want to say a massive thank you to all of you guys. It's been great, and I honestly wish we had longer as it's absolutely flown by. So yeah, thanks for joining and thanks for sharing some incredible insights. And to everyone listening today, I hope you found it insightful. I appreciate it's been care focused, but obviously these challenges aren't only experienced in the care sector. So I hope you can take what you've heard today and apply it back with you guys as well. So thank you to all of you for tuning in, and thank you to people who've submitted questions. I'm sorry we've run out of time, but yeah, thank you. And over to you, Sean.
Thanks, Holly, and thank you, John, Kirstie, Neil, and Phil. Fantastic and amazing to hear about how holistically you think about this whole space engagement experience and respecting the very real constraints you have around pay, making it even more challenging. So yeah, thank you for that. It was fascinating. I did say we'd try and get some questions. I'm looking at the clock as well. We've got a few minutes, so we're going to try and dive into a couple of questions we've got. Gavin, I think you're going to bear the brunt of these, if you'll forgive me, but I'm going to kick off with one about pages, Gavin, if that's all right. Maybe an opportunity for you to give a general update, because I know that's an area of the app that we really want to push forward in the next quarter or two. The specific question is around using HTML5 pages, or maybe allowing WordPress integrations, but maybe take that as you will.
Yeah, I see the question. I think the update here is as I mentioned in that one slide where we had the three big chunks that we're focusing on, identity just being one of them. One of them is content, and that's not just content, it's also slightly wider around this inclusive comms that we've been talking about. So a lot of the examples here that are in that question will be included as part of that. So bringing video into more spaces in Blink, that is very much top of the list, but also all these other practical things, making it easier to create content, making it more rich, and an update coming on that very soon, Sean, in short. But yeah, it's all wonderful inside. Keep adding it and keep going to product boards, into portal.joinblink.com to leave any of these sort of insights and things that you'd like to see in Blink. We're looking at those things and we're considering them all the time.
Yeah, I think it's fair to say that the comms/content part of Blink and the analytics part of Blink are definitely the two areas that we're going to be focused on over the next 6 months. So please do keep this feedback coming. Maybe it's a good segue. Flo, there was a question here around how we collect opinions and before deciding what to do. I don't know if you want to share a bit about how we do sort of prioritize the product roadmap just quickly.
Yeah, absolutely. So there are multiple ways that you guys can share your feedback with us. Of course, you can actually submit it through the app and it goes directly to our customer support team. You can also directly contact support through support@joinblink.com. But the two main places to share your feedback will be the product portal, which we can share a link out again to everybody, where you can see all of the products and all of the features that we're going to be working on, what we're working on now and what's going to be coming very soon. And then that's where you can submit your ideas and tell us how important they are to you. And then, of course, you can reach out to your dedicated customer success manager if you have one. And if that doesn't work, of course, you can email me directly at florence@joinblink.com.
Yeah. And I can assure everyone that every single one of those is read, is put into the process. We catalog them all, we tag them to features, so we know how many people have asked for each feature. So none of that goes to waste. So please do get involved. Gavin, a couple for you. I'm going to give you two at the same time, if that's all right. One is around the bulk upload feature, and does it allow you to update team membership and deactivate accounts? And the second thing is for protected content, what happens if the phone doesn't have face or fingerprint scan available?
Yeah, sure. So on bulk updates, yes, absolutely. You can make updates to the teams that people are in all at the same time. There's a part of the spreadsheet that will show you those teams. We've also made it easier in the spreadsheet to see which updates you can make and which you can't make. So some parts, for example, some teams that may come from Active Directory that you can't update, but that will be shown in the spreadsheet just to make it easier to show which updates are possible. So yes, on that first one on bulk updates. On the second one, so there's also the option of having a PIN code on slightly older devices, where we will just fall back to the PIN code that you've got set on your device. In which case you would have to set that PIN code, and we'll ask for that.
Great, thank you. I'm going to come straight back to you as well, Gavin. There's a question about, are there any plans to allow user provisioning from Google?
Yes, there are plans to do more sync, not just with Google, but there are plans for other types of sync other than, for example, Active Directory.
Gotcha. Does Google, can we not do that via Skim, Gavin? Does it not support? Is that not a possible?
It is also possible through Skim, and if this is your use case, get in touch and let's chat, because it might very well be possible with some minor changes on our side.
All right, and last question, Flo, this one's for you, I think. It says, I'm interested in setting up some more single sign-on options. How do you contact customer success to discuss next steps?
Good question. So actually, in the application marketplace, in the admin portal, there's a button that you can press that will link you directly to us in order to tell us a bit more about the SSO that you want to set up. Or of course, again, you can reach out to support@joinblink.com or email your customer success manager directly.
Thank you, Flo. Awesome. I'm afraid we're out of time. If we didn't get your question, we will. If you left your name, we will follow up directly with you. So thank you for those. Thank you again to all the panelists. Thank you to the Blink team for all the amazing work you do every day. And thank you to all of you for being part of the Blink community. Thank you for having faith and trust in us. We are working hard behind the scenes to try and make Blink everything you would like it to be. And yeah, can't wait to talk to you all again about that next time. Until then, take care, and I'll chat to you all again soon.